Hi, my name is Ecoee Rooney, and I am president of the Louisiana State Nurses Association. I am here today to respond to an incident that took place recently. It was a violent attack on an ICU nurse at a hospital here in Louisiana. Of course, it was great concern to everyone who read the story, and it is very disheartening and scary when one of our own is injured. But we know that this takes place far too often and in many different healthcare settings. And so we want you to understand that the Louisiana State Nurses Association has been and continues to work hard for its members and for all nurses in the state, whether members or not. I would like to give you a little more information on what Louisiana State Nurses Association is doing in particular to this incident. And I would like to introduce our Health Policy Director, Health Policy and Advocacy Director for the Louisiana State Nurses Association, Dr. Ahnyel Burkes Jones.
Hi, LSNA has been dedicated to this initiative since 2014. We've partnered to pass the Battery of Emergency Room Personnel, Emergency Service Personnel, and Healthcare Professional Bill, which strengthened the repercussions for workplace violence all the way up into a felony. In 2019, we partnered with other stakeholders on HCR 60 to provide recommendations to improve workplace violence. And in 2021, we actually led the charge with HCR 121. You'll be reassured to know that 2 nurses are actually chairing that task force to look at how to implement the recommendations from HCR 60. So those recommendations include increasing public awareness and criminal penalties related to workplace violence, advocating to ensure nurses and other healthcare providers have access to training, resources, and other things related to workplace violence. We are also advocating for employers and healthcare providers to maintain safety plans to ensure the protection of workers. We're also advocating for universal reporting to truly understand the scope of the problem and to inform future health policy.
Thank you so much, Dr. Burkes Jones. And I'm sure that many nurses are not familiar with the work that has been taking place and that is happening at this time. I would like to invite any nurse who is interested in joining the association to please join us at LSNA. Your voice is needed. Your membership would mean so much to us, and we appreciate the work that you do as nurses every single day in the state of Louisiana. Take care, be safe.